Everyone, I'm Dr. Harish Tenetti, maxillofacial surgeon. I'm so glad you all are encouraging me, sending so many mails. Thank you so much for the love, and thank you so much for taking my suggestions and implementing. And I am able to connect to so many young budding dentists, and that feels so good. And people are asking me for advice. I don't know if I'm capable of giving advices, but I would certainly try to put some positivity in you. So if you have something, please feel free to talk to me. And being a surgeon, I go to different clinics for consultations. I go to different setups where there are broken teeth, or where there are cyst tumors, where there are cancer cases, and I take them all to my operation theater, operate them. There are so many clinicians I meet day in day out regularly. So there was this confusion last time, as I mentioned in the other video. There was this confusion that the doctor was unable to diagnose the problem, and then they ended up treating it differently, and then they ended into complications. And there was a patient side pressure, and doctors had to deal legally and all. So I thought the ground reality is, for any treatment, your diagnosis is so very, very important. And for diagnosing, the very vital part is your investigations. What investigations you order, or how you proceed from the examination to the radiological examination. These two important hands of your diagnosis part. If you can correct them, if you can actually examine it properly, or if you can clearly see an x-ray and diagnose things properly, then I think most of your diagnostic part will be right. So I thought I'll make series of videos on any condition that come to your clinic, how good you can diagnose it, or what investigations you should order for. The moment you see the investigations, you should have that mind to identify what is going to trouble you when you are treating. So just ordering investigations is not sufficient. At the same time, you should not keep on ordering all kinds of investigations, like get this blood examination, get this CBCT, get this OPG also, get these other blood tests also. So many investigations if you order, patient will also lose confidence in you. At the same time, you will also end up in nowhere, because you order so many things and you confuse yourself. So I thought young budding clinicians or young dentists would be benefited with this video. So I will make series of videos, keeping the time limit in my mind. I'll make small videos for all conditions, and what x-rays, and how do you see the case, okay, the reality of the case. Then you will be able to diagnose it properly, and if you diagnose it, I know all the dentists can treat it properly. So the moment you diagnose, you can treat it. That's my intention. So I want you to give these tips, starting with the basics first, the impaction or extraction. Then we'll go slowly to the higher, the salivary gland, the TMJ and all, right? So whenever a patient walks to come to your clinic for extractions, there are certain things which you should keep in mind to order. Today we're going to discuss about the what are the investigations, or what is the examination protocol for wisdom tooth extraction, or any tooth extraction in general, right? This is a very, very important and very basic aspect. Generally, when a patient comes for wisdom tooth removal, or extractions, grossly destroyed extractions, they have this doubt in their mind, whether this doctor is going to take out properly, the injection is painful or not, or what about the post surgical problems and all. And patient comes to you with doubt. In general, also for a layman, dentistry is extractions, okay? So if you can perform your extractions properly, if you can do your extractions well, patient will have trust on you, right? So to gain that trust, To do a proper treatment to the patient, I think you should diagnose the tooth properly. Diagnosing the tooth, you know it is grossly decayed, so what else can you diagnose in a wisdom tooth extraction? Or you know it is impacted, so what else can you diagnose in a wisdom tooth? So that's very, very, very important point which I'm going to stress upon today. Just knowing it is decayed is not important. You have to know thoroughly about that tooth which you're going to extract, right? So there are certain examination protocols and there are certain investigations you have to ask for. First, we'll look into examination part. The moment patient comes to my clinic, the first thing I notice, suppose if they're going for extraction, first thing as a surgeon I notice is their mouth opening. Very, very important. Their mouth opening. Very essential. If they have less mouth opening, chubby cheeks, big tongue, I'm telling you it is very difficult. The second issue which I see is infection status. If the infection status, if infection is active, if they have a hot tooth, you know it's very hard for the local anesthesia to work, and your patient will start having pain when you are extracting, and that leads to constant patient disappointment. They feel you are uh, you're not good at doing extractions, or you are doing it harsh, something of that sort. So infection is very, very important. The next very, very important, the third important issue is patient's general condition. Whenever a patient comes to me, it becomes a mantra for me. I constantly practice this, and the moment the patient walks to my clinic, I keep asking them, is there any medical issue? Is there anything you want to share with me? Is there any history of hypertension, recent surgeries, be diabetic, or asthma, or any other medical condition you want me to inform? Then they said, there's no problem, no problem. Then I probe each one. Are you asthmatic? Is there any history of fits? Like that. So step by step, even though they say I don't have anything, even then you have to put few important conditions which are going to trouble you. Hyperthyroidism, or are they on some steroids, something like that. So put that across and then find out the answer. So that's very, very important. And patient's general condition. Patient is weak, frail, unable to take it. You don't want to be hero there. Don't show your heroism when patient is weak or frail. You just don't barge into extractions. So if patient condition is weak, he is unhealthy or she's unhealthy, very cautiously you have to handle those cases. Okay. The next very, very important, the fourth and important point is the tooth's general condition. Whatever tooth you are going to extract, how is the condition of that tooth? The condition of the tooth, I mean, we will divide into two parts: the crown part and the root part. The crown part is it brittle, is it accessible, is it root canal treated, or is it crowned, or is it grossly destroyed, or multiple fillings have been done, grossly restored, something of that sort. And look at these things, very, very important for you to look at these things. I also look at the bruxism patients and panchur patients and aged patients. These three are a big no when you're doing extractions. If they are aged 70, 75, and they are not mobile firm teeth, I'm telling you, you'll be going to have a hard time when you are extracting. So be careful with aged, very aged patients. The teeth are not mobile, so be very cautious with them. Okay, they have a tendency to become brittle, and RC treated, definitely they are brittle. And pan chewers, because of the chronic chewing, the bone becomes sclerotic, so that they are also very dangerous, right? So these things you have to keep in mind when you are assessing, and this has to become subconscious when you are taking up a case. The moment you see a patient, you should have that, yes, this patient is going to be like this. You should know the full journey of how the patient is going through the extraction. The other important aspect which we see is the root part. To see the root part, we have to go for IOPA basic. Nowadays there are RVGs. I suggest all the dentists, even though you don't make up a good ceiling or good interiors, doesn't matter. Even though you don't have a fancy outside LED board, doesn't matter. Take an RVG. Very, very essential. very very essential. RVG, emergency drugs, basic instruments. These are very important. People spend lot of money on interiors, AC, the false ceiling and all, but try very hard to buy a nice good handpiece. So I suggest all the young budding dentists who are coming out, please spend on a good x-ray equipment, RVG, good quality, good company. I don't endorse any company, good company RVG, okay, and take pictures, take RVG, store them, right? So once you take a radiograph, if at all the patient is affordable, I generally take an OPG instead of an IOPA, for a gross understanding of what it is and how the overall condition is. There are so many cases where we found out an odontogenic keratocyst, amyloblastoma. So the OPG gives general idea about the vital structures like sinus, the canal, the mental foramen. These things are very important. Even though you don't do any good, don't do any harm to the patient. So always prefer an OPG. Check what you're seeing, see what you're doing, and do what you told to the patient only. Very 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 important. And I tell this to all my students, I'm telling you all, never over promise patients, never do an under treatment. This is my mantra for all my years, 10 years. Never overpromise a patient. Never undertreat any disease. Never undertreat any disease. They will come back with vengeance, and a patient will be revolving around you. So always treat aptly and treat correctly, and diagnose it properly, and then do the treatment, right? So this is one thing I wanted to establish to all of you. Never undertreat a disease, never overpromise a patient. The other important, once you take an OPG, see the jaw, see if there is any fractures anywhere. You should make this as a habit, okay? Never just look at OPG, just the tooth. You should make it a habit to see the entire OPG, read what the OPG is trying to tell you, then come to that individual tooth of interest, then see how the tooth is there. Now when you're looking at the tooth, you have to look at the adjacent teeth if there are any damage, because after your extraction, if you say that the adjacent tooth is damaged, or adjacent tooth needs a filling or root canal treatment, patient will think that you have done that mistake. So always tell the patient prior what you're going to do, what you have found out in your in the x-rays, right? The other thing which very very important when you are going for an extraction and looking at the x-ray is the root structure, number, size, shape, the bony anchorage, and the depth of the tooth, and the root thickness, and all the other conditions like RC treated, non RC treated, or the roots resorbed, non resorbed, are they curvatures, or is it dilacerated, is it ankylosed, cementosed, hypercementosed, whatever is the condition, observe it properly. Okay, you will see clearly there's a hypercementosis in old patients. Once you do this, once you know that there's enough information with you, then you proceed for the extraction, right? The other important aspect which generally younger dentists or new dentists miss is getting blood reports done for any extraction. Make this a habit of writing a simple blood test, CBP, BTCT, bleeding time, clotting time, and make it a general habit to read those blood pictures, CBP and BTCT. If patient is on diabetic medicines, ask for an RBS and FBS, HbA1c. Then your other very very important and simple drugs, simple investigations are, if they are on anticoagulants, if they are general anticoagulants like clopidogrel and ecosprin, BTCT would be fine. But if they are on some coumarin, warfarin drugs, always ask for INR and try to read INR. By constant practice, you will know that how to read an INR, how to go about it. and I will definitely make a video on a separate blood analysis. For now, if you are doing an extraction, if you are going for root stump extractions, if there are slight mobile tooth only, why I have to order all these things? I'm telling you, most dangerous things happen when you are dealing with small extraction, simple tooth. Only then the most dangerous things happen. So always keep this in mind. Once you commit crime, once you commit mistake, no one is going to come for your rescue. So always remember this: ordering your blood picture and investigations is like your insurance. If you don't order them prior and if you end up in trouble, no company is going to help you out. So always remember this: take prior care, right? This is one thing. The other thing is, when you are extracting, when you are trying to take out a tooth, understand where the tooth is going to come out from. So the path of extraction is vital when you are taking out a tooth. So path of retrieval, path of extraction is very, very important. If you can keep that end result in the mind and start working on, I think you will be fantastic. And if you still have any doubts, and I'm here to help you. So I'll make a separate video for all the investigations. Once you are you go through all the videos of investigations, I think you will have a fair idea about how to go about any case that walks into your clinic, what all investigations, and how to come to a treatment plan. Okay, I think I will help you all. And in case you have any doubts, please put it in the comment section. Anything else you want me to talk about, I'm here to talk. Thank you so much for patient listening, and I'll see you in the next video. Okay, bye bye, take care.